Trenton 365 with Jacque Howard. Profiling the businesses, organizations, and people that make Trenton better.
Hello, friends, and welcome to another edition of the Trenton 365 Show. I'm your host, Jacque Howard. You can follow us on Twitter at Trenton 365, the Facebook page, Trenton 365 Show, and the website, Trenton365.com. You can also follow us over WIMG 1300, the two-time Stellar Award-winning station, and you can follow us on the website, WIMG1300.com, Facebook and Twitter as well. And if you're watching, it's over WPHY, Channel 25, covering Mercer County, New Jersey. So we've got lots of information to get out to you. I am always encouraged when someone wants to talk about health and nutrition and diet and exercise, because I think that's one of the cornerstones, especially in African American and Latino Hispanic populations, something that isn't at the forefront. So we're going to be talking about that tonight. But before we do that, I want to also encourage you all who have voted in the electoral process, regardless of the outcome of who won. Thank you for doing your due diligence and taking the efforts to do that. There's lots of people who have done a lot of things, given blood, sweat, and tears to provide that opportunity to us to do that. So I encourage you to keep your chin up, whether that was your candidate who won or it was not. But let's just remember that we all have to work together in this, and that together we can work together, and I believe should work together to build a better community for everyone. Remember, civic engagement radio is the hashtag. So in the studio with me, I have Micah Freeman, who I've known for quite some time, and her last name is familiar, probably because of her husband, James, who is part of the R.E.A.C.H Entertainment Jazz group, jazz promotion group that I'm a part of, and they've been on the show on several times. The website is R.E.A.C.H, REJSJazz.com, and there you can find out about what we've done in the past and what we'll be doing in the 2017 season. And my new friend, Cliff Pollard, and I don't think he plays professional football, but when I first met him, that was one of the first things I thought. He came in with some New York Giants gear on, and I thought, maybe, just maybe, I recognize this guy from being on the field, but I don't think so. So, Micah, you're going to go first. Welcome to the Trenton 365 Show.
Well, thank you for having me. I am so excited, a little nervous, but I think we'll be fine. This is a special time to get health information out to our community. So I'm excited to be here.
Awesome.
Thank you.
And we're going to get back to you in a minute and have you do a little bit of background about who you are, etc. But Cliff, welcome, and thanks for being a new friend, and welcome to the studio, and welcome to the Trenton 365 Show as well.
Thank you for having me. I look forward to this interview. I'm very excited.
Awesome, man. And folks, you'll see that he is a very infectious personality. He's one of those people who when they come into the room, they absolutely light it up. I mean, when he came in and introduced himself, I was like, there's something special about this young man. So, Clifford, welcome to the show. So, Micah, back to you. And I'd like for you to give a little overall summary about who you are. And then let's jump right into the program that's going to take place tomorrow, Wednesday, November 16th.
So again, my name is Micah Freeman. I am a Trenton, born and raised in the city of Trenton, and I have a deep love for this city. I work for the Trenton Public Schools as the supervisor of nurses and 504 coordinator for our students. I've been with the district for 15 years, and in this capacity, I just became an administrator 3 years ago. So I'm excited of all the great things that we have the potential to do and that we are doing.
Mm-hmm. And you said you've been an educator for over 15 years. You're a Trentonian. And in your capacity, working in health and nutrition, talk about that. And then I want you to drill down a bit on the 504 coordinator, what that actually means.
Okay. Well, for the Office of School Health Services, which is is under our special education department. Some of the school health services that we provide are, of course, the school nurses are in every building of our Trenton Public Schools. They provide emergency services, immunization monitoring, follow-up on different student health needs, care for emergency illnesses. We promote health education, medication administration, and just the overall safety of the student while they're in school. The 504 coordinator, when a student has a medical disability, they're not their general education student, they have, we want to make sure that we're not discriminating from their civil rights. So just like their peers, we want them to be equal to their peers. So if there's some reasonable accommodations that we can make in the schools for that student, then that's what we do.
Okay, great. And Cliff, now over to you. Let's give a little background information about who you are and your capacity working with the Trenton Public School System.
Well, I'm a paraprofessional. I've been working for the Trenton Board of Education for 11 years, and on many different levels, elementary, middle school, back now to elementary, and find myself involved in various community activities when it comes to working with our students and just making sure to talk to parents, get out, and encourage them to come see us, be involved with the school. You know, it takes a village to raise a child, so it's not just going to be on our end with education, it's going to be on everybody's end. Mm-hmm. And I like to be a part of that as often as possible.
Mm-hmm. And in your capacity as a paraprofessional within the health, I guess the health department in Trenton Public Schools, you're out and about dealing with the students, dealing with the community, et cetera?
Oh, all the time. And it's one of the biggest things that I try to push in saying that if you have a healthy body, you have a healthy mind. And it's that much easier for you to learn in the classroom. If you're not worried about, being sick, or if you're properly taking care of yourself, all your concentration can be on getting those A's and B's.
All right. That's right.
That sounds like a PSA right there.
That's right.
But I mean, it's obvious. I mean, you're someone who pays attention to taking care of the physical aspects of your body, and I'm glad that you mentioned how there's a correlation between being healthy and then being able to be focused in the classroom, et cetera. Can you drill down on that a bit more and give some examples?
Well, one of the biggest examples is that when I was working in the middle school, I was the assistant coach for the boys basketball team. So we would have early morning practices, and the running and sweating and just a chance to be able to exercise, charge their brain up before school started. So by the time they walked into the classroom, they were ready to go. They were awake, they weren't sluggish, they had ate a proper meal, which is something that we always push. Make sure that you eat something healthy before you go in the classroom, and everybody's grades went up.
So from a nursing standpoint, Micah, I can see that you're excited about that, and it's nice to hear that.
I am.
So talk about that from a nursing perspective. Exactly what Cliff said about the importance of diet and nutrition and exercise, etc.
So you're right. It's a connection. You have to. If we're sick, how are we going to learn, right? If you're sick, you don't want to go to work. You don't want to go to school. It may be an issue with paying attention. So the school nurse in that building, she's there to support learning. And how she can support learning is address the issue, return the student back to class, because that's why they're in school, is to learn. And we are a support to our educators in the building.
That's a great way to put that. Over the years, just like everything else, I mean, human beings were supposed to be naturally progressing to some grand pinnacle of life that we will never get to, but we should be progressing to that. How has healthcare changed? And Mike, I want to start with you. How has healthcare changed in schools? And then Cliff, I mean, I think that you're probably a little younger than I am, and then I'd like to know your perspective of what you've seen change as well.
So healthcare has changed because of different reasons. Parents, if a parent lost their job, they may not have health insurance. So that means if a student has a chronic condition, there may be an issue with going to see a follow-up physician or just being seen regular maintenance. So because, and we have our students, we have a diverse population, okay? And with that, and this is the reason that one of the reasons we're having our health fair, and it specifically says access, because we want our students to have access to health insurance. We want our students to have access to, if they need their vision checked, if they need any type of screening done. We want the ones who don't have health insurance, we want them to get those screenings done. Our school nurses do that in the schools. The draw to come to the health fair is to get our students who do not have health insurance to get health insurance. So we have some other activities that's going to motivate them to come.
And if you have something else?
No, I'm just excited. I'm trying to think of all the things. School health and education is definitely a connection, and we need to continue to advocate for our students who don't have a voice.
And Cliff, over to you.
Well, I would say this. There's one thing that I've noticed as I've gotten older is that when you're much younger, you feel impervious. You believe that you can't get sick. Nothing can hold you down. But the problem with that is, in reality, it's not true. And having some type of health insurance, some type of medical checkup, just understanding how the body works really is quintessential for your development as you get older. So that when you're no longer a spring chicken, you know how to properly take care of yourself, how to eat, no more junk food, no more, eating late at night, getting outside, even if you do nothing but just walk, that is important. And I see a lot of the kids, they don't have as much time outside as they should. They don't do anything that's physical as they should, or they're eating too much junk food often. And I think this is the start right here with this program tomorrow to help turn that around.
Thank you, Clifford. I definitely agree, with we want to start early. That's why we have an early childhood program. We promote health there as they go into the elementary, middle school, high school. We want to promote health because, again, as Cliff said, you have to have a healthy body. But if you don't have a healthy body and you don't have health insurance, where are you to go? We don't want to put demands on the emergency room because that's not their primary place to go. We want to do preventative health and have, if the person have health insurance, they can go to see a health provider.
So how is that? I know that's been a strategic effort nationally. Mrs. Obama, First Lady Michelle Obama, has been very much outspoken about the importance for health and nutrition and for children. And how have you actually seen that translate to small urban cities or urban environments like Trenton? How have you seen the emphasis from the federal government down to local governments and institutions? How have you seen that translate into where we are right now? So
with this position over the last 3 years, I've seen in particular some of our students who, when they register for school, they may not have their immunizations. And so you ask the question, well, why don't you have your immunizations? It's because I don't have health insurance. And again, we have a diverse population from all over, and so this effort is to build connections to the community because there's some, we want to make school is a safe place, and we want our families to feel safe. I don't want to get into the government part of it, but I know that there are resources in the community that can help our students. So that's what we're concentrating on.
And I'd like to stick just sort of with the cultural challenges because they are, language barriers are often an issue here in Trenton as well. I mean, we've got a very diverse and eclectic population representing not only Eastern European countries, but also African countries, the Middle East, Asia, and several Latino, Hispanic countries as well. How is the city of Trenton and the public school system, particularly from a health standpoint, bringing those students and those families together and sharing information?
So, well, this is the Access Health Fair is one way to, again, we can't solve the problem. However, we can build connections to the community. Um, we want to build relationships with our own families, our students and families, but we also want to build relationships with the community resources. For example, we are partnering with Henry J. Austin and the city health department to have specific days where our students can go and get immunized. They can go and get their medical checkups, because they have identified also with our collaboration that this is an issue. And as an advocate for students and with the love that I have for the city, I feel that this is an important issue because we want them to stay in school. Every student must have their immunizations. The only way you cannot have immunization if you're religiously exempt or medically exempt. It's a state law that a student must have their immunization. So like I said, over the past few years, I've seen a growing trend of students who do not have health insurance.
Mm-hmm. And you believe that the lack of health insurance has a trickle-down effect on the students, how they are physically developing, etc.
Yes.
Okay,
yes.
so it's something that...
So because a lot of our the trend is to go to the emergency room, right? And that's fine because that's what they're there for. However, we need to have some stability. We want them to have, just like relationships with your teacher, you should have a relationship with your physician, and they know what it is that you may need. So.
Great, thank you very much, Micah. And Cliff, I want to bring it over to you, and I'd like to change the subject a little bit. So when I was a child, high school on down, the only adults who were in the nurse's office were females. They were only women, and I know culturally things are changing quite a bit. I mean, there's plenty of females who are, or women who are doctors and men who are nurses and vice versa, and from different backgrounds and so forth. And I think that shows how we're progressing as a culture and as a nation. So you being involved in, number one, being a man of color, being involved in education, being involved in the athletic side of it, but also obviously in the health and nutrition side of it as well. How has that played out for you, and what are some of your experiences with that?
Well, I will say one of the nicer things that I've noticed, especially going now to Columbus Elementary School, I work with kindergarten now, and their snacks are extremely healthy. They get little baggies of cauliflower or oranges, and I've never seen that before. Like that's even growing up in a suburban area, I never seen those type of snacks presented, and that's a start. That is a big start because once you get used to eating healthy, it makes it that much easier. And just to tie into a point that Michael was saying earlier, I think it's very important that families develop a connection with a healthcare provider, whether it's a nurse or a doctor, because, like you said, it's okay to go to the emergency room, but what type of relationship are you developing there when on a constant basis the emergency room is taking in various people? There is no chance to really get to learn each other, and then you can't have that direct service provided to you. And as you said, I think it's very, very good to have men and women on both sides of the coin when it comes to nursing and being a doctor. Thank you. I mean, knowing Micah, and then my mom is a nurse, and she probably kicked me if I say this, but it's been 30 plus years for her. So I get to see, how it changed from when I was small to seeing her, and then going over to the hospital to pop in on her and seeing male nurses. It's really nice to see. And it's more encouraging because as a male, sometimes it's a little difficult to talk to a female about whatever issue you might be having. And to chance to talk to a male, on a face-to-face basis, you might be a little bit more comfortable, be able to say what it is that's going on without, being embarrassed or just saying, I'll stay home and suck it up or fight the cold or whatever's going on.
Mm-hmm. And it's interesting that you said that. I'm glad you mentioned that as well, that it helps develop relationships when you have opportunities to speak and share your experiences with people who look like you and with people who don't look like you. It all depends on that situation and that environment, but it's important for you to have those options and choices. And as I approach 50 years old, and most men who are at that 40-year-old point, that there's different things that you need to pay attention to health-wise. And as you put, you may not want to have those conversations with someone of an opposite sex. You may want to have those conversations with someone of the same gender who can fully understand exactly what you're going through in the tests, etc. Right. So that's what I'm getting at. And if you guys meet me, we have a meal, I'll tell you a story about how I joked around with my doctor who has retired, but Dr. Harold Brown was my doctor for well over 20 years, and when I was approaching 40 years old, and I was going to get the dreaded, examination that most men fear, I joked with him and said that I'd be switching my doctor to a female who had smaller hands. It's just a little joke. We'll talk about that at a later time. But send me an email and we can meet for a meal and we can talk about all the things that I'm doing with the program. Trenton365show@gmail.com. So I'm in the studio with Micah Freeman and also with Clifford Pollard. And the main reason is that we want to talk about an event that's coming up tomorrow.
Yes.
November 16th, 2016, beginning at 5 p.m. And it is called the R.E.A.C.H Health Fair. And this will take place at Martin Luther King Elementary School, 411 Brunswick Avenue. And this is a rather new school. I mean, this school is less than a decade old. It's on a very large parcel of land. It's right on 206. For those of you who don't know, Trenton, Brunswick Avenue is 206. If you keep going straight south on 206, you run right into the Battle Monument. You can actually see the Battle Monument from the steps of Martin Luther King Elementary School. So this will be done in partnership with Trenton Paraprofessionals, hence Cliff, FAST, F-A-S-T, conversation with board members from 5 to 5:30. There will be dinner provided. I don't know what it is, but I bet it's something very healthy and delicious. Access to community resources, health insurance providers, free vision screening, immunization, flu shots, and more. So, Micah, you were talking about the importance of being involved in the community and having that relationship with your healthcare provider and also with the families and where those families are. Was that part of the impetus between setting this event up?
Yes. Again, we've seen a trend where our students were uninsured. Uninsured and underinsured, and that you're limited to certain things, and immunizations was the big one. And I did, we said, how can we put our ideas together to address the need, which is getting our students in health insurance, and also having fun. Right? Because we're in a learning environment. We want to connect our community resources, bring them to the schools. So our families are diverse population, are very comfortable with the schools. You don't have to get on hold. You don't have to wait in line. We want to open our doors. Trenton Public Schools always want to open our doors to our families and our caregivers. So this is why we started, thought of the R.E.A.C.H Health Fair, so that every student has an opportunity to have health insurance.
Now, if folks want to talk to you or someone else in regards to the R.E.A.C.H Health Fair, which is taking place 11/16/16, which is tomorrow, Wednesday at 5 p.m. If they'd like to ask you some questions, or if they'd like to have you maybe set up an event, how could they get in contact with you?
So, my name is Micah Freeman. Our contact number is 609-656-4900, extension 5783, or they can email me at mbfreeman at trenton.k12.nj.us.
That's it. Yeah, you nailed it. Yeah, I joke around with all my educator friends here in Trenton. I'm like, we couldn't come up with a better, easier website for everybody.
That's a long one.
Exactly.
That's a long one. But I want to say, you sometimes you ask the question, why should I go to a health fair?
Yeah.
Like, why? Sometimes they're boring. Sometimes they're I get little flyers or brochures. Well, there's 4 points that I want to say about a health fair. A health fair is informative. Every vendor that we have was intentionally selected. Every vendor, because it has a direct connection with our students. We have over 25 confirmed vendors who are there. You learn something new. You're exposed and you have that access to new information. So again, you share. It's a great way to meet new people. It's a great way to connect. It's a great way to build relationships. Like I said, we have intentionally selected the community resources for our students. There are freebies. We are going to serve a dinner. It's conversation with board members. There's a lot going on in our school district. There's a lot of positive things going on, and we will be serving dinner. The vendors are, they were told that this is an interactive, fun health fair, not a boring one. So you definitely get, you'll have bags of goodies. And at the end of the day, it's about learning, it's about having fun, and it's about staying healthy. I do want to put in a plug that we have 20 raffled baskets for the holidays, compliments of our Airmark nutrition program.
That's fantastic. So in addition to, folks, this is what the flyer looks like. For those of you on TV, you will actually see this afterwards. I'm sorry, but I do encourage you to contact Micah Freeman, 609-656-4900, extension 5783. This is one event. I'm sure Micah and the team of people who are helping to put this on would gladly have a conversation with you about having others, and I'm sure there's probably others that are listed as well. So the Trenton Public Schools invites everyone to its annual free access health fair at Martin Luther King Elementary School, 411 Brunswick Avenue, Trenton, New Jersey. This is 11/16/2016, Wednesday the 16th, from 5 p.m. to 7 p.m. Community resources, health insurance, free visual screenings. It's going to be a fun event for children. I hope to be able to swing by and grab some images and share them with the folks who can't make the event, and see exactly how much is happening. I want to transition now and talk to you, Cliff, about Trenton paraprofessionals. First of all, what is it? And just talk a bit about it.
Well, a paraprofessional is a teacher assistant. So we come in and we provide all the necessary assistance that the lead educator needs in the classroom. So we're right there with our the proverbial nose to the grind, nose to the dirt, however you want to say it, getting it in with the students. When the teacher is working with one group, the paraprofessional is working with another group. We're a team. And it's a necessary piece of employment for the Trenton Board of Education.
Mm-hmm. And I'd like to actually have you drill down on that. How, I know you mentioned about your mom being in healthcare, being a nurse, and growing up in that environment. I'm sure education was at the forefront, very important and very critical. But what made you want to, after you got to a certain age, decide that you wanted to be involved in education as a profession?
I would have to say you grow up and you see those who were supposed to make it, big doing something, don't make it. They didn't have that necessary support, whether it was from home or in the classroom. A lot of times students will fall through the cracks. And it's necessary to have somebody there with, brick and mortar, plaster, what have you, to seal that crack up so them students don't fall through. And having gone through so many years of education, like I have my master's degree, I realized that this is what I want to see others do, especially, our people of color. It's very important to go out and get some knowledge, whether it's a trade school or a college, whatever it is that you want to do, you need to go real hard in getting that.
Okay. We'll be back after a very short break, folks. You're listening to the Trenton 365 show. I'm your host, Jacque Howard.
Listen to the Trenton Church of Christ broadcast every Sunday evening from 9:30 p.m. until 10:30 p.m. only on Music for the Soul, 1300 WIMG.
What's up, WIMG listeners? It's your boy, Mr. Root.
And Lady Heather.
And we are here because we want you guys to vote.
Vote.
It's that time again, guys. 1300 WIMG. We are in the Small Market of the Year category for the Stellar Awards.
The Stellar Awards. We're at it again. We need your help.
We need your help. So go to thestellarawards.com and vote for us. We're in category number 4. That is Small Market of the Year category.
That's thestellarawards.com. Do it now. Not now. Right now. Log on and vote. Small Market category WIMG 1300 AM.
And you need to vote in all categories, but make sure you definitely vote in category number 4. That is the Small Market of the Year category, 1300 WIMG AM. Ed Long.
Grandma, can you come out and play?
Sure, Ellie. Oh my, you might want to come here and help Grandma.
What's the matter, Grandma? Can't you stand?
Oh, sorry, honey. It's my knees. They don't work the way they used to.
Does this ever happen to you? Are you on Medicare? You may qualify for a pain-relieving knee brace at little or no cost to you. Call the health hotline to see if you qualify. Our friendly agents are standing by 24/7 to help you. We also have braces for your shoulder, ankle, or back pain. And if you're covered by Medicare, you may qualify for free delivery.
Grandma, slow down. I can't keep up.
Maybe you can use a knee brace too, Ellie. Catch me if you can, kiddo.
Call now to get your pain-relieving knee brace. 800-296-1261. 800-296.